Hi AP Psychology students and welcome back. Today we are going to begin our discussion of a selection of the different psychological disorders that are in the DSM, right? And this aligns with topic 5.4. Today we're going to be focusing specifically on objectives that relate to the symptoms and possible causes of anxiety disorders, the symptoms and possible causes of obsessive compulsive disorders and related disorders, and the symptoms and possible causes of trauma and stressor related disorders. We're going to have two essential questions that'll focus our conversation today. So first, what symptoms distinguish disorders that are based on fear, worry, and stress? And also, what are the biopsychosocial causes of those disorders? So first, we're going to start with anxiety disorders. And anxiety disorders are mental health conditions characterized by excessive fear and anxiety, right? And like we talked about, right, everybody has fear, everybody worries, but these cause a significant impact in our daily functioning and behavior. Right? We have those 3 Ds, deviant, distressful, and dysfunctional. They are very common but treatable mental health condition. So how common are they? So specific phobias affect up to 12% of the US population. Social anxiety disorders about 7%. Generalized anxiety is 3%, and agoraphobia is about 1.7%. So it's a fairly large, chunk when you put all those together in terms of the overall population with anxiety disorders. All right, so first, specific phobias. So specific phobias have the following criteria. First, they have a marked or fear or anxiety about a specific object or situation. And there is avoidance behavior, so the person seeks to avoid whatever the object or situation is at all costs. They recognize that the fear is excessive in relation to the actual danger the object or situation possesses. Examples of this, there are lots of different phobias, but two kind of common examples are acrophobia, which is fear of heights, and arachnophobia, which is a fear of spiders. Next, we have agoraphobia. So the criteria for agoraphobia is a marked fear about 2 or more of the following 5 situations. So you've got public transportation, open spaces, enclosed spaces, like shops or theaters or elevators, crowds or lines, or just generally being alone outside the house. And part of the reason, or part of the fear, comes from the fact that they are worried that in these situations they would not be able to escape, or they would not be able to get help if they needed it. And this often leads to restricted movement and social isolation, so they refuse to leave their home or go outside because the fear gets so intense. Then we have panic disorder. So the criteria for a panic disorder is panic attacks. So your panic attacks have to be reoccurrent, and they have to come on unexpectedly, and they have to have 4 or more of the following. So you see heart rate, trembling, sweating, shortness of breath, chest pain, nausea, dizziness. You definitely don't need to write all of these down, but make sure you have a few so you kind of have an idea of what a panic attack would look like. And then there's also the added need to worry about additional attacks happening in the future. And you have a significant maladaptive changes, right? Maladaptive is negative changes in behavior related to the attack. So, this can be related to versions of agoraphobia, or not wanting to go somewhere or do something, if you are fear of having a panic attack, etc. Now, there is in the DSM, or not in the DSM, but when we talk about mental illness, there are these ideas of culture-bound disorders. So these are disorders that exist in one culture but not another, right? So there is a cultural variation on a panic disorder seen in Caribbean, Latinx, Hispanic cultures called ataque de nervios. And this is basically similar to a panic disorder. However, it usually involves a event to the family, like some sort of traumatic loss or family event that triggers it, and there's also some amnesia about the panic attack that happens after it happens. Next, we have social anxiety disorder. So the criteria for this is a marked fear or anxiety about 1 or more social situations. So this is social interactions, being observed, like if you're eating or drinking something, or performing in front of others, like giving a speech. The situations are avoided, or if they have to, take them on, it's intense anxiety in the event. And then again, another cultural variation of this. So Tajin Koifusho is a Japanese culture dependent disorder, and it's very similar to social anxiety disorder in that you have that fear, anxiety kind of about others, but in this case the fear is very focused on offending others due to the appearance of yourself or some sort of body concern, so blushing, body odor, body deformities, etc., and then it leads to avoidance of social situations. Next, we have generalized anxiety disorder. So these characteristics are excessive anxiety and worry occurring more days than not for at least 6 months about a whole bunch of things. So difficult to control the worry, and the anxiety has these body symptoms. So 3 or more of these are needed: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or sleep disturbance, right? So an overwhelming kind of sense of worry about everything around you. Sometimes generalized anxiety disorder is referred to as GAD. Okay, so now that we've talked about some major anxiety disorders, let's review some of the causes of these anxiety disorders. So first of all, if we're looking at psychosocial causes, we know that there can be learned association. So we learned about classical and operant conditioning, and then somebody could learn a phobia or a fear due to classical conditioning, right? Something that was originally neutral, like let's say dogs, can be connected with some sort of unconditioned stimulus, and then the reaction becomes fear. Or operant conditioning, there could have been some sort of punishment or reinforcement that continues this connection between these ideas. We also know that chronic stress changes the brain. So we've talked about ACEs and how those can actually lead to long-term health impacts, and just chronic stress overall leads to changes in the brain, and that those changes can lead to a higher incidence of anxiety disorders. Okay, so what about the biological factors? So genetic predisposition, we know that anxiety disorders run in families. We know that there are neurotransmitter imbalances of any one of these neurotransmitters, sometimes more than one. And we know that there are brain differences when we look specifically at the activity in the amygdala, right? So having an overactive activity in the amygdala, which controls our fear, right, and aggression. Next up, we have a category that's related to anxiety but is now separate. So it's called obsessive, compulsive, and related disorders. And these are mental health conditions that basically have 2 parts: obsessions and compulsions. So unwanted thoughts and repetitive behaviors. The 2 we're going to focus on are obsessive compulsive disorder and hoarding disorder. And just so you have a little bit of background, hoarding is about 2 to 6% of the population. Obsessive compulsive disorder is 1 to 3, and there's a lot of overlap between them, right? This would be an example of that comorbidity where people have hoarding disorder and OCD. So obsessive compulsive disorder, the criteria is first, obsessions. So you have to have, so obsessions, compulsions are both. So what's the difference? Obsessions are defined as reoccurring, persistent thoughts, urges, or images, and the idea is that you attempt to ignore them or suppress them, so that you don't have to deal with it. And compulsions are defined as repetitive behaviors or mental acts that you do in order to get rid of the obsessions. So the idea is that you do the behavior as in order to reduce the anxiety or distress that's caused by the obsession. And these rituals are time consuming, right? And they cause significant impairment. So OCD can have lots of different kind of ways that it manifests itself. So here's just a few kind of common example ones. So I know a lot of some students are kind of aware, or they always think of that contamination one, which is fear of germs, being contaminated, infection, and then the compulsive behavior is washing or cleaning rituals. But there are also aggressive obsessions, which are fear of harming others. There are superstitions, which is fear of certain bad colors or numbers. There are religious obsessions, symmetry and exactness obsessions. Sometimes they can overlap as well. Hoarding disorder, right? The criteria is persistent difficulty discarding or parting with personal possessions, even those with no value. Strong urge to save items or extreme distress associated with discarding. And accumulation of a large number of possessions that clutter the living area so that you cannot use it. So I have an example here of what this looks like for you. If this is supposed to be someone's bedroom, there is no bed for that person to sleep on, right? They cannot use the area as intended. So what are some of the causes of these disorders? So psychosocial causes, we have learned behaviors. So did they get reinforcement in the past, or every time they do a compulsion and it relieves the anxiety, that's a positive reinforcement. Cognitive differences, so they find that people with hoarding sometimes have other issues with decision making, and that's part of the reason why they have such a hard time getting rid of things. And then environmental triggers. So we do find a link between childhood trauma and infection, specifically strep, which can then get past the blood-brain barrier and impact the brain. Biologically, we know that it runs in families. We know that there are imbalances in the neurotransmitter serotonin, and we know that there are brain differences. So when they look at brains of people who have OCD or hoarding, they find differences in the prefrontal cortex and the basal ganglia. All right, finally, we have the category of trauma and stressor related disorders. And these are mental health conditions that are characterized by stressful and potentially traumatic events. About 6% of US adults will experience PTSD at some point in their lives, and about 5%, so 5 out of every 100 adults have PTSD in every given year. PTSD is more common in women than men. So, post-traumatic stress disorder, the criteria: exposure to a traumatic stressor. So you have to have a stressful traumatic event, right? Then you have these symptoms where you're re-experiencing the stressor. So you have intrusive memories, flashbacks to the time where it happened, or nightmares about the event. You avoid any trauma-related stimuli. You have cognitive distortions about the event. So you remember it happening differently than it did, or you place unnecessarily blame or fault on yourself. And you have this increased sense of arousal or kind of jumpiness. So your startle response, your hypervigilance, sleep issues. Now, what are some of the causes of PTSD? So psychosocial, a trauma, right? You have to have a trauma, and these are some common areas where trauma can happen. And then biologically, because a lot of people experience trauma, right? But not everyone gets PTSD. So there are biological differences. They find that people with PTSD have low levels of cortisol and high levels of CRF. You don't necessarily need to know what CRF is, but basically CRF is what kicks in your sympathetic nervous system. So they have an intense fight or flight response that's maybe more intense than others. They have neurotransmitter imbalances in GABA, glutamate, and serotonin. And they have brain differences. So we find brain differences in the hippocampus, the amygdala, and the prefrontal cortex. All right, AP Psychology students. Today we talked about anxiety, obsessive compulsive, and trauma-related disorders, and we focused on the symptoms of different types of each disorder, different types of disorders under each category, and then the causes of these disorders. So that's all for now, AP Psychos, and remember, psychology is flippin' awesome.